Hi, good afternoon. Welcome to Wednesday Live. This is me, Vandana PS, joining you from Neetu's Academy. So, in this video, we will be dealing with Part B, a sample question from Part B, as well as a question. Throughout the question, in 20 questions, we'll be dealing with Part A. Okay, as usual. So, first of all, I'll show you a question from Part B, then we will discuss the answer. So, I'll give you 2 minutes for the question, then let's check out. Okay, so this is the question. Okay, so yes, back to the question. So yes, about Part B. So in Part B, as we know, only after the completion of Part A, we will have to finish Part B and C. Okay, so within the 60 minutes of time, we will get almost 45 minutes for the completion of B and C, and there is no separate time for doing Part B. Okay, so we can take almost 10 to 12 minutes, maximum 12 minutes for the completion of that Part B. Okay, so roughly I can say you can take almost 2 minutes for the completion of one question. And what type of questions in Part B? I can say multiple choice questions with 3 answer options, which means a question will be there and 3 options will be there. Then we have a respected paragraph. Okay, so either you can read the question, then read the options and you can move to the paragraph, or you can read the question, then you can read the paragraph, then you can read the options. Okay, so it's up to you. You can do either two methods. Okay, yes. Okay, Clarina, yes. Sansu, Shiny, Anu, Yogeshwari, yes. Good afternoon, everyone. Okay, so already you got the answer. Yes, very good. Let's see. So this is the question. The notice about shagas is to inform that. So what are the keywords from the question? As you know, this is a notice, and shagas inform that. So my keywords, notice, shagas and inform. Okay, then what about the first option? So in which category the question falls under? So we have different categories of questions in part B, and in which category the question falls under. So we can say this comes under the category notice. Okay, notice, in which we are reading for the purpose. Okay, and from option A, about 10% for shagas are reported in the US congenitally. So I can say 10% is my keyword, then reported US. And from option B, the parasite can enter the body through sense organs. So the keywords parasites, then through sense organs. Okay, and from option C, the parasite bites. So parasite bite is the most common way of transmitting of the disease. So my keywords parasites, bite, transmitting. And what about the paragraph? So this is the para to all nurses. Transmission through bite from the tritomine bug is the most common way of getting Chagas disease. So the disease is transmitting through which bite? Tritomine bug's bite. It is not through the parasite bite, it is through tritomine bug bites. Okay, so that we can eliminate which option? Option C can be eliminated because it is not through parasite bite, it is through bug bite. Okay, and what about the rest of the lines? So the Trypanosoma cruzi parasite, so the name of the parasite is Trypanosoma cruzi, is present in the bug's feces. The parasite can enter a human or animal when the bug defecates on the skin during or after its blood meal, allowing the parasite to enter through the bite wound. The parasite also can enter directly through the eye and other mucous membrane. So from here, we can connect with which option? The parasite can enter directly through eye, other mucous membrane. So that can be related with option B. The parasite can enter the body through sense organs. Okay, then tritomine bugs live indoors in cracks and halls of inadequate housing, such as mud walls and thatched roofs. So individuals living in rural areas of endemic countries are almost at risk. Then Chagas can be transmitted from mother to baby during pregnancy. It is estimated that 1 to 10% of infected mothers will transmit the parasite to their infants, although only a case has been reported in the US. So how many cases reported in the US? Only one case. Not 10% of cases, it's only one case reported in the US. So we can eliminate which option? Option A can be eliminated. It is contradictory option, or I can say opposite option, and option C is all about not mentioned, or okay, so we can say contradictory. Answer is option B. The parasite can enter the body through sense organ. So this should be the answer. Clear? Any doubts? Okay, so a lot of answers I have got. Shani got option B. Okay, Anu, Yogeshwari, GN Kochus, Alfie, Tessie. Okay, yes, Reshma, Ansu, Binsi, Vidya, all of you got option B, and that is the correct answer. Excellent. Okay, so now we are moving to the next one, that is part A. So we have another new topic here. So this is the topic, that is tethered spinal cord. Okay, so what about part A? What do you know about part A? So that is our usual topic regarding part A. And in part A, I am starting with the same thing, time management. Okay, so we have 15 minutes for the completion of part A. Within this 15 minutes, it's very important you have to complete 20 questions. And this 20 questions can be categorized into 3 different types. So the first set of questions can be called match the following questions, that is 1 to 7. And the next 8 to 14 set of questions can be called short answer questions. So 1 to 7, which can be called match the following, and 8 to 14, that can be called short answer, and the rest of the questions, that is fill in the blanks. Okay, so what about the timing? I've already told you it's all about 15 minutes. So we have to complete 20 questions within this 15 minutes. Okay. Then what is important in part A? So as you know, part A is all about locating particular answers from one of the texts. So we have 4 different texts, that is text A, text B, text C and text D. So we are locating particular answers from one of the texts. Okay. Then okay. So yes, so what are the keywords that we can mark from part A? Okay, so what are keywords? Which means when you read each of the text, it is very important to mark some keywords just to identify the answers. It will help you to identify or locate your answers. So what are the keywords? But before that, we have a technique in part A. So what is the method or the strategy that we are applying in part A? And that is all about skimming and scanning, as you know. So what is skimming and scanning? Okay, Shiny, okay, it's clear. Okay, hi Nabi. Hi Lisa, hi, yes. So what is the method? What is the strategy, Lisa? Do you have any idea which strategy that we are using in part A? Okay, so that is all about skimming and scanning. As you know, it is all about skimming and scanning. Okay, so what is skimming? Skimming, which always can be connected with fast reading or speed reading, whereas scanning, which means we are searching for some important words from the text. Okay, so yes, fast reading. Okay, so yes, I'll read the text, then we will decide and we can locate the answers. Okay, so a tethered spinal cord happens when your spinal cord abnormally attaches to the wall of your spinal canal. Usually your spinal cord moves freely inside your spinal canal. So from first sentence, I am just marking tethered spinal cord, then spinal canal. When your spinal cord attaches to your spinal canal, this can limit its movement and cause of tension. This tension can cause your spinal cord to stretch and may damage it and restrict blood flow to your spinal nerves. So my keyword from second one is spinal nerves. Then your spinal cord is the thick column of tissue running from your skull base to the center of your back. Nerve signals running through your spinal cord help you move and feel sensations. Then tethered spinal cord syndrome occurs most often in people who have had open spina bifida. Some experts estimate that up to 1 in 2 children with a history of myelomeningocele will develop tethered spinal cord syndrome. However, it's important to understand that you can have tethered spinal cord without having obvious spina bifida. Okay, then text B, it is all about signs and symptoms. So the heading, then the symptoms of tethered spinal cord can vary widely from person to person. Some babies have symptoms of tethered spinal cord at birth. Most of the time, tethered cord symptoms develop in children as they grow. Rarely, others don't have any symptoms in childhood, but develop symptoms as adults if they were undiagnosed earlier. In children and adults, tethered spinal cord syndrome may be associated with, then we have a lot of problems mentioned: difficulty, dimples, discolored, numbness, severe leg, then scoliosis, skin tags, trouble with bladder, fluid filled with incest, then loss of muscle. Okay, and what about text C? It's all about diagnosis. A neurologist, healthcare provider specializing in the brain, spinal cord, nerves usually diagnoses a tethered spinal cord. They physically examine you and your child and ask about symptoms. They typically also use imaging tests such as MRI, myelogram, CT scan, ultrasound. Then all about a pictorial from text D. Then I'm marking all the numbers mentioned here, the words which related to research, again the numbers, signs and symbols, meta-analysis related to the research, systemic, then 12, 11, review, okay, studies, again inclusion, adult patients, 1, shortening, 55, 74 and 22. So these are my keywords from text D. Okay, so you can likewise, you can complete speed reading and scanning, skimming and scanning within 2 minutes. Okay, then we are moving to the first question now. Okay, yes, of course, Lalita, we can, and you have to, okay, you have to underline during the exam, because otherwise you can't understand, you can't locate your answers within the short period of time. So you can underline, I will say you should, okay, you should underline the keywords while you attend the exam, during the exam. Okay. Yes. Okay, Lisa, skim and scan. Keywords finding, yes. Shiny, okay, yes, we can underline, yes, everything. Okay. So the first question. This side-to-side curve of your spine is one of the symptoms of the condition. So side-to-side curve, then spine. So these are my keywords. So side-to-side curve of your spine. And very clearly they have mentioned about the symptoms. So where is the symptoms mentioned? Okay. So symptoms mentioned, as you know, which is from text B, because already we have marked the title. So it's all about the symptoms. And which symptom is talking about side-to-side curve? And that is scoliosis. Okay, so which is called side curve on the spines. So that is scoliosis. So answer should be in text B. Okay, a lot of answers. Oh, okay, Bimsi, Alfie, Shiny. Okay, Jian, Ansu, Reshma, Vidya, Tessie. Okay, Jubi, Lisa. Excellent. Text B. Okay, Biji, it is from text B. So now tell me, what about the second question? So what are your keywords from the second question? Let me know in the comments. What are your keywords from second question? The technique that is most often employed to evaluate a tethered spinal cord. So my keywords, technique, a method, most often employed, used, evaluate tethered spinal cord. So my keywords, technique, often employed. So what technique? So technique or the procedures mentioned in text C, all about the test. So which test is using there? It's all about the MRI. Okay, so which is in text C. So our answer is, it is from C. Okay, so for the freshers I'm saying this, don't write, like if the question is from text B, don't write text B. It is wrong. Okay, just write that letter only, just B. C, likewise you can write. Okay, so what are the answers? Okay, Alfie, it is C. Vidya, okay, C. Biji, C, okay. Yes, C, yes, okay, everything, yes, C. Then third one, factors. Factors that trigger the occurrence of tethered spinal cord syndrome. So what does that mean? What is your answer? Factors that trigger the occurrence of the tethered spinal cord syndrome. So where is it mentioned? About the syndrome, particular explanation about the syndrome. It is in text A. A tethered spinal cord happens, factors that occurrence, okay, related to the occurrence, happens when your spinal cord abnormally attaches to the wall of your spinal canal. Usually your spinal cord moves freely inside your spinal canal. So that is all about text A. Okay, Vidya, you got the correct answer. Excellent. Text A. And fourth one, who are usually administered? Who? Administered to perform a tethered spinal cord diagnosis. So my keywords, who, administered, and diagnosis. So what is your answer for fourth question? Any idea? Okay. Fourth one, who are usually administered to perform? Okay. It is text C. Very good, Reshma. So may I know that answer? Who are usually administered? Okay, Jubi, it is text C. Yes, okay, Yogeshwari, text C. So who, which means you can say it is from the fourth question, that is from text C. So who is doing that? It is by the healthcare provider, right? Who are usually administered to perform a tethered spinal cord diagnosis. So that is mentioned in text C. See, the neurologists. Okay, a healthcare provider specializing in the brain, spinal cord and nerves usually diagnoses a tethered spinal cord. So answer is from text C. Okay. Then the next one. Okay, neurologist. Very good. Yes, Biji and Shiny. Yes. Then fifth one. How many column shortening studies imported for screening? So studies which is mentioned in the pictorial. Okay, so what about the studies mentioned? How many? It is all about 12 column shortening studies imported for screening. So that is from text D. So our answer is D. Okay, sorry, it is not text D. From it is the fourth question, that is text C, and fifth one it is text D. Yeah. Then sixth one, what is the purpose of the spinal cord? So, purpose, spinal cord. So, what is the purpose of the spinal cord? So, where is it mentioned? The purpose. Okay. So, your spinal cord is the thick column of tissue running from your skull, base to the center of your back. Nerve signals running through your spinal cord help you move and feel sensation. So, what is the purpose? What is the use of this? What is the help? How it is helping? So, to move and feel sensation. So, answer is from text A. Okay. And the final one, 7th one. When do children present with signs of tethered spinal cord? So, when? Children. Then signs. Okay. So, again signs and symptoms which is mentioned in text B. In children and adults, tethered spinal cord syndrome may associate with. And again, here they have mentioned in children as they grow. Signs can happen, symptoms can happen, develop as they grow. So, answer is text B. Okay. So, that's all about 1 to 7. Match the following. Any doubts? Okay, a lot of answers been. Okay, Saumya, Jubi, Vidya, Anshu. It is text B. Very good. Yes. So, now we are jumping to the next set of questions, that is 8 to 14 short answer questions. So, you can write it in a word or a short phrase, which means maximum 3 words, not more than that. So, the first question, the presence of which condition? So, we need the name of the condition. Which condition in people generally causes a tethered spinal cord? So, which condition? Any idea? 8th one, which condition? The presence of which condition in people generally causes a tethered spinal cord? So, that is from the condition that is mentioned in text A. Okay, so what is the condition called? So, tethered spinal cord syndrome occurs most often in people who have had open spina bifida. Okay, so that is the name of the condition, open spina bifida. Okay, so the answer is from text A, 3rd para, 1st line. Then the next question, yes, okay, open spina bifida, yes, GN coaches, yes. Then 9th one, the most common diagnostic method conducted in younger infants are. The most diagnostic method. So what is the method? So methods mentioned in text C, as you know, which is related to infants. So what is the method? So that method is ultrasound. So what is related to the question? See, this is used most commonly in young infants. So those are the keywords, right? So answer is ultrasound, which is from text C. Okay. Okay, Jubi, it is ultrasound. Okay, Reshma, Alfie. Okay, GN, okay, Vidya, Shiny, Binsi, Jansi. Okay, Anisha, Archana, it is ultrasound. Yes, Gopika, ultrasound, very good, excellent. Okay. Okay, so what about 10th one? Any idea, 10th question? What condition? So, always answer to the question. Okay, short answer questions, answer to the question. What condition? What condition? Might be present around 50% of the children, which in turn triggers the onset of a tethered spinal cord. So, what condition? What condition? Okay, Archana, okay, Gopika, Tessie, it is ultrasound, yes. What about 10th one? Any idea? What condition might be present around 50% of the children? It is myelomeningocele. Okay, myelomeningocele is the answer, which is from which text? It is mentioned in text A. Answer should be myelomeningocele. Okay, so tethered spinal cord syndrome occurs in most people in people who have had open spina bifida. Some experts estimate that up to 1 in 2 children with a history of myelomeningocele will develop tethered spinal cord syndrome. However, and this is all about, it's important to understand, you can have a tethered spinal cord without having obvious spina bifida. So answer is myelomeningocele. Very good. So that is the correct answer. Then what about the next one? 11th one. Okay. The inclusion of which category in the study group lead to the exclusion of 11 studies? So studies which is mentioned in the pictorial. So what about inclusion and exclusion? Okay. So what about that? So inclusion of which category is the question. Which category of patients or which category? Okay. So that is from the pictorial. See, full text view review 11 studies excluded. So that is a keyword. Because of inclusion, another keyword of adult patients. So answer is adult patients from text D. Very good, Biji. Answer is adult patients. Okay. 12th one. The test that precedes CT scan to watch the movement of contrast dye around your spinal cord. So the test, name of the test. What test? The test that precedes CT scan to watch the movement of contrast dye around your spinal cord. So that answer should be, which is from text C. The test, diagnosis, the procedures mentioned. Answer is myelogram. Your provider injects a contrast dye into your thecal sac. So answer is myelogram. Okay. Yes, Alfie, very good. Correct answer. Okay, Reshma, it's not adult, it is adult patients. Okay, because patients are not mentioned in the question, so that you can write adult patients. Okay, Ansu, myelogram. Okay, Vidya, Shiba, Jansi, Shiny. Okay, Sarala, it is. Okay, myelogram. Okay, yeah. Then next one, 13th. What is the kind of birthmark seen in patients with a tethered spinal cord? So what kind of birthmark? Okay, seen in patients. Any idea? What is the kind of birthmark? And that is from signs and symptoms. Okay, so what kind of birthmark? That answer is hemangiomas from text B. Okay, from the signs and symptoms, answer should be hemangiomas. So that is the type of birthmark mentioned. Hemangiomas should be the answer. Okay, so 14th one, actually there is a typo happened with the 14th question. There is a repetition of the question. Okay, so you can just strike it off the question. And okay, so I'll give you another question. So just tell me, can you find out that answer to the question? Okay, 14th one. How many eligible column shortening study was there? Okay, is it possible to answer my question? How many eligible column shortening studies was there? Study was there. How many? That is the 14th question. How many eligible column shortening study was there? Any idea? So this is a surprise question. So can you tell me? So study, which is mentioned in the pictorial. And another keyword was I have told you about what? Column shortening. So that is also in text D. Okay, so how many? And that is, answer is 1. 1 eligible column shortening study. So answer is 1. Okay, yes. Very good. Excellent. Kopika, Jubi, yes, Reshma, answer is 1. Okay, so the next one, that is fill in the blanks. So same instructions, you can write it in a word or a short phrase, which means maximum 3. So 15th one, the blood flow to the dash get restricted since the tension in spinal canal may take the spinal cord stretched and damaged. The blood flow to the dash. To what? Any idea? Okay, so answer is from text A. As you can see here, what is the answer mentioned? This tension, so that those are the keywords, can cause your spinal cord to stretch and damage. So those are the another keywords. And it restricts blood flow to your spinal nerve. So answer should be spinal nerves. Okay, so that is the correct answer. Then 16th one. 22 studies excluded for lacking surgery for tethered cord syndrome or without dash follow-up. So it's all about the study. So we can move to text D. Okay, so what about the follow-up mentioned? As you can see here in this box, full text review, 22 studies excluded for lacking surgery for tethered cord syndrome or without 6-month follow-up. So which is the missing word there? It is 6 month. Answer should be 6 month. Yes, Juby, it is 6 month. Yes, dear. Very good. 6 months, right? It is a hyphenated word. Yeah. So hyphen should be there. Okay, otherwise you will not get the answer. I mean, the marks, hyphen should be there. So 6 hyphen months. Sorry, month. Okay, so the next one, 17th. The utilization of high frequency dash are done in the ultrasound to review the inside of your body. So what is that? The utilization of high frequency dash. So what do you mean by that? It's all about high frequency. So it's all about the ultrasound. Your provider uses high frequency sound waves. So that missing words are sound waves. So answer should be sound waves from text C. Okay, a lot of answers. Okay, Reshma, Alfie, Princey, Shiny, Juby, Vidya, Sheba, yes, sound waves. Yes, Archana, it is sound waves. Very good, dear. Okay. Then the next question, 18th. The patients with a tethered spinal cord will have severe leg or back pain that often extending to the rectum or dash. So what about 18th one? What is the missing word there? Okay, it's all about, the symptoms. So maybe it is from text B, I can say. So severe leg or back pain. So those are the key words. Often extending to your rectum or genital area. So answer should be genital area. Okay, yes, Princey, very good. Alfie, very good. Yes, Juby. Okay, Vidya, Shiny, Saumya, yes, it is genital area. So it should be option. That is the particular answer, genital area. Okay, then 19th one. Some experts estimate that up to half of dash with a history of myelomeningocele will develop tethered spinal cord syndrome. So what about that one? Half of dash with the history of myelomeningocele. So that myelomeningocele is which is mentioned in where? Okay, so that is from text A, the last para. So what about that? See, some experts estimate that up to 1 in 2 children with the history of myelomeningocele. So answer should be children. Okay, not one. Answer should be children. Then 20th one. In myelogram, your provider injects a contrast dye into your dash, the membrane that surrounds your spinal cord. So into your what? So what is the correct answer? Okay, so that is here. Myelogram is mentioned here. Your provider injects a contrast dye into your thecal sac. Okay, so the answer is thecal sac from text C. Okay, Juby, very good. Okay, Biji, it is thecal sac. Excellent. Okay, so any doubts regarding any of the questions? Okay, Binsi, it is thecal sac. Okay, Princey. Okay, excellent. So yes, so that is the end of today's session. So if you have any doubts regarding any of the questions and any answers, you can comment it there. I'll reply back to you. Okay. Okay, so as I was always saying, please do additional materials every day if you want to pass this exam. If OET is your priority, so please do additional materials every day. Okay, and please attend the live sessions every day. So stay tuned. We will meet tomorrow. Thank you. God bless you all.